Data doesn't lie, your go-to for the science behind the art of parenting.
Hi guys, welcome to this week's video. In the next, 3 or 4 videos, we will talk about everything around infant feeding. So breast milk, breastfeeding, infant formulas, preterm infant formulas, donor breast milk, nipple confusion. We'll touch on all of that, and of course there's a lot to be said about it. So check out my blog each week and I will give you more in-depth information there. Either way, let's dig in. So this week we're talking about breast milk. Now, breast milk is ideal because of 2 reasons in particular. That's kind of how I break it down in 2 reasons. One, it provides the baby's nutrition so that baby actually just grows on a somatic level, growing with weight, hence head circumference. And 2, it acts as a biological or has bioactive biological factors that promote baby's brain growth, baby's immune system growth, as well as baby's gut growth and function after birth. So that's all important. Here's the what that's in breast milk that promotes all of this. Breast milk is made up of 87% of water, right? Crazy, so much water in it. It's made up of 3.8% of fat, in particular triglycerides and essential fatty acids, like DHA, which is important for brain growth. It's made up of 7% of lactose, and lactose is the type of sugar that's found in breast milk. Now, between the fat and the lactose, those 2 components provide 90% of the baby's energy needs. That's crazy, right? And it's not as you would think that would make up most of breast milk, but it doesn't. So it packs a powerful punch. And it's made up of just 1% of protein. In particular, the type of protein, there's a ratio of like whey to casein, but whey is more predominant, and that's the more easily digested and absorbed type of protein in human milk. And we'll talk about why that's different when we're talking about the infant formulas in that video. Now, so the type of protein that's present in human milk would be predominantly whey protein, which is more easily digested. And lastly, it has a host and mix of biological factors, minerals, vitamins, all those things in there that are necessary. The things that I will highlight, however, where breast milk is slightly deficient is in vitamin K as well as vitamin D. We do not have enough vitamin D in our breast milk for our babies. So even in moms who get supplemented with the max dose of vitamin D, 2,000 international units a day, those babies do have adequate supplies at birth. But here's the trick: by 8 weeks of life, meaning when they're 2 months of age, their baby's vitamin D supply is completely depleted. So babies who are breastfed do need vitamin D supplementation. Babies who are formula fed are not as depleted, of course, and sunlight helps us get some of that. The other thing is vitamin K, which we give all newborns at birth because whether you're formula or breastfed, even you're deficient at birth, right? You don't have vitamin K. So we give you that in order to prevent babies getting hemorrhagic disease of the newborn. It helps the clotting system. Now, so that's the what that's in the breast milk. Here's the how, like what's the current recommendation in breastfeeding. We recommend exclusive breastfeeding for the first 6 months of life. We recommend continue breastfeeding till at least 1 year of age, and in that time, of course, you're introducing regular foods. And we also recommend that with breastfeeding, you are, doing everything hygienic around it, right? Like washing your hands before, making sure that your pumping parts and all of that are sterilized, and so that you're not transmitting infections, of course. Now, let's talk about the dynamics, like how does breastfeeding or breast milk change? Interestingly enough, at different stages of breastfeeding, your breast milk is different for your baby. So your breast milk at birth has higher protein content. It actually has like 1.6 grams per every 100 ml of breast milk. By the time you were like 3 to 4 months into breastfeeding, or your baby's 4 months old, you're about 0.8 grams per 100 ml of breast milk. By the time you get to 6 months, it's down to like 0.7, 0.6 grams by every 100 ml of breast milk. So it does change, knowing that your baby's going to be getting, it's crazy, right? Like, this is just insane, knowing that your baby's going to be getting other sources of food and other sources of protein. So those are just sort of the important things I thought I would highlight about breastfeeding and breast milk. And in the next 2 videos, I will do infant formulas, I will do donor breast milk, I will do what's the other one I want to touch on nipple confusion as well. So if you like this video, share, like, and subscribe, and I will see you guys next week. Actually, before I go, there's one thing I wanted to mention about breast milk. The other thing that affects breast milk is, because I just remembered the comment from one of my IG followers that asked me a question, and she mentioned that with postpartum depression, what we talked about last week, omega-3s helped her through her postpartum depression. And the thinking behind that is moms' bodies are preferentially sending their DHA into their baby when the baby's in them and into their breast milk as they're breastfeeding. And DHA is important for the moms, is important for the moms also because it's been linked to postpartum depression. So the most recent study I saw on it, I think it was in 2019, it was a review of a lot of different studies, and their conclusion was that omega-3 fatty acids, if moms are depleted in omega-3 fatty acids, and the ratio of omega-3 to omega-6 unsaturated fatty acids is what would contribute to mom's postpartum symptoms. So mom's diet also affects baby, right? So if mom is eating well and getting all these good things, they're also transmitted in her breast milk, which baby eventually gets. So she has enough to share. So that's kind of what I wanted to mention before we leave, because I remember that comment. So again, ask me questions. Like I said, if you have them, I will answer them. Share, like, and subscribe, and I'll see you guys next week.